we've heard a lot about the health care plan, and I've said on record, I don't know if whatever passes, if it passes, if it's going to be good or if it's going to be deficient or what. But my feeling is we get the health care bill passed, and then we, the 300 million Americans, can work to get Congress to change it and work on it in the future. But I feel this country needs some type of universal health care. And having said that, when I hear what Germany has and India and all these other countries, I kind of feel embarrassed that we don't have it. So as you being a medical doctor and, top of the line in your field, what is your professional and personal
Well,
opinions?
Albert, very, very simply, because one could spend hours on this, I believe there should be universal health coverage. I believe it's a disgrace and a source of embarrassment to this country that 48 million Americans are without health care insurance, that so many people are turned away, nonsense about pre-existing conditions, and then you reach a certain level, pharmaceutical drugs being sky high, people that absolutely need them to stay alive and so on. So I do believe that there should have been a way. I'm a little disappointed that Obama did not push for this harder, that Senator Max Baucus backed off and other Democratic senators backed off. There should be, at the very least, for openers, a public option so that people can decide if they want to go with the government as opposed to the Holy Grail insurance company, which is reaching in your pocket and robbing you just like a pickpocket would do, and so on. So that's my brief and quick answer. I hope that a bill will pass. And once it does, you make a very good point, perhaps the door will be opened and it can be built upon in future years.
All right. Well, I appreciate you saying that. And I think it is a disgrace.
Yes, it is.
But on another subject, I have to ask you
You had some calls too, It's up to you. I mean, no, I'm just.
I'll tell you what. Let's get this last call.
No, it's Albert. It's up to you. No, please. It's your
Get the call,
show.
Dr. Wecht.
No,
get the call. Go for it.
Go ahead. Yes. Hello.
Hello.
Yes, this is Nora Parker. How are you?
How you doing, Nora?
Fine. I'm so glad I got in because I'd like to ask Dr. Wecht, as a surgical tech, could you come on my program, Profiles in Pittsburgh? I beg you to speak about the medicine, donors, and transplants, just everything that I know the Pittsburgh public would love to hear. I love you on my show also. Can I grab you?
Yeah,
Thank you, Al.
Call me at my office tomorrow. I'm listed in the phone book. 281-9090, 281-9090. Give me a call at the office and I'll be happy to work something out, okay?
Thank you, sir. Love
All
you,
right,
sir.
thank you. I hope she'll pay me as much as you do, Albert.
Well, Dr. Wecht, don't do that. I don't have any money. I'd be in trouble. That actually is one of my co-hosts. She couldn't make it in today, but that's the famous Nora Rose Parker Carter. And she's a wonderful young lady. And don't worry, I'll give you his phone number if you didn't get it. But I have to ask you something. You have testified for the prosecution of many court cases, for the prosecution and the defense. Yes. You've done that throughout the United States. But many people probably don't know you've done that in other nations, other countries. So my question to you is, understand, if I'm not mistaken, you even testified in a court case in Vietnam. Is that correct?
No, I've testified cases Singapore, the Philippines, Taiwan, Mexico, Australia, England, Israel, Canada.
Can you tell us a little bit about
Well, they're fascinating. They vary greatly. I can tell you that in most of these countries, a small, unimportant thing is you stand, you don't sit.
Wow.
And sometimes after a period of many hours,
it's not fun.
You can try to lean on the railing. The systems are different. Judges will play a much more active role. In most of these places, you do not have jury trials, such as we have in this country. In most of these, there will be an individual judge or a tribunal. So that's a very, very big difference.
Yeah, that's a huge
big difference. I find it fascinating. And I like that interplay, quite frankly, because the judges are intelligent, educated people, and I like to get right down to the heart of the matter rather than play games and engage in semantical sophistry, like like so many attorneys
yeah.
are wont to do. So it is indeed fascinating, and I have enjoyed those experiences in foreign countries.
And I understand also that there
And by the way, another place where I've been,
where's that?
I was just thinking about it. I didn't testify. Well, I did testify in a kind of a quasi-legal proceeding as a follow-up. And I was just thinking, I said to my wife, my God, people are being killed there. And there I was some years ago in Islamabad, in Pakistan, doing an exhumation autopsy on a commander-in-chief of the Pakistani army.
Oh my
I wouldn't want to go over there today and do that.
Yeah, probably not. Well, we're down to about 4 minutes, but I just wanted to ask you, you have done autopsies now on probably about 18,000
17,000 myself, reviewed about 35, 36,000 others reviewed, signed off,
Right.
supervised. Yeah.
Wow. Now, I guess I always say humanity matters and life matters. Now, as a physician and have done basically investigated death all these years and all these, what would you say to people about life? What you know what I mean? Having
Albert,
dealing with death, how do you personally appreciate life?
I can say this, that I'm sensitive to and keenly aware and always intend to be of every death, and I can't help but think about those individuals. Some deaths obviously impact upon you more in terms of the psychological, emotional drama, especially children, infants, sudden infant death syndrome, the explanation for which we still do not have. You see a chubby 9-month-old baby that just died suddenly in sleep last night. Infants, people who are murdered, innocent victims, teenagers in motor vehicular accidents, and so on. So every death is real. Some hit you harder than others. Obviously, it would be foolish of me to say that every death is the same.
Exactly.
In a broad philosophical religious sense it is, but in real life, it's not. So I can only tell you that being a forensic pathologist provides an opportunity and presents a constant challenge to you in thinking about life, the meaning of life, and so on. But now you get into the whole philosophy of theology and so on, and everybody's entitled to their own beliefs.
Well, I also know you're very much a family man, and I'm glad you mentioned your son. Before we go, could you give us the name of the rest of your family members? And
Well,
what
my
their
son David
professions
Wecht
are?
is administrative judge of the Orphans Court.
Okay.
And responsible for the overall Orphans Court with 13 judges there. My second son, Dr. Daniel Wecht, is a neurosurgeon. My third son, Ben Wecht, is program director for the Cyril H. Wecht Institute of Forensic Science and Law at Duquesne University.
Wow.
We sponsored all of these national symposia
Exactly.
and everything. Recently did one on National Academy of Sciences report. And my daughter, my youngest and my only girl, she's an obstetrician gynecologist, Ingrid Wecht. And she does her work mostly at West Penn Hospital. So those are my 4 kids, and they have great spouses. And then there are 11 grandchildren who range in age from 5 to 14. And we all get together every Sunday at my home.
Great.
My wife spends the whole day cooking.
I think that's
great. It's marvelous. That's the most meaning in life for me.
There you
is
go.
the family. That's
Well,
number one.
And I wanted to touch on that. I thought that was very important because people
Thank you.
know the other facts about you, factors and facets of you, but you really are.
And I
a
forgot
real
to
family
mention
man.
a great wife who's an attorney, a graduate degree in international affairs
forget the wife.
from Gispia at Pitt, and who runs my office as my executive secretary and kind of runs me too. Everything from taking out
get in hot water.
everything from taking out the garbage cans to telling me to do this and that. But I'm fortunate. We'll be celebrating in this month. We'll be celebrating our 48th wedding anniversary.
Well, happy anniversary in advance. And before we go, I just have to say, I have some little bit of bad news. You remember how you said you get together with your family and your wife does the cooking every Sunday?
Yeah, right.
Because you forgot her, you're doing the cooking this Sunday. You have to do the cooking. You messed up.
My cooking consists of calling up a Chinese or an Italian restaurant and bringing in a whole boatload of
hey,
food.
that's all
when
right,
it's turned over to me, that's what I do.
Oh, gosh. Well, with that, we just want to say this man is a wonderful man, and there's nothing really else to say except thank my audience, thank
Thank
Dr.
you,
Wecht,
thanks for inviting me.
Annette,
Thanks for your
and,
gracious generous works in it.
good night, everybody.
And thank you, audience.
And
Yes,
remember,
sir.
humanity really doesn't matter, so
pleasure.
don't forget that. God bless.
Okay, Albert.